Hello, I'm Dr. Angela Anderson from Spearfish, South Dakota, and I'm having a conversation here today with Sherry B. Smith. We're going to talk about the Republican bad, damaging bill and how its effects are going to be on South Dakotans. Sherry B. Smith has a long career in healthcare, first as a nurse and then subsequently as CEO of Deadwood Lead Hospital. So I'm going to dive right in, Sherry B.
Do it.
And, all right, and ask you questions of how do you see the Medicaid cuts in this bill affecting South Dakotans?
Well, there's a myriad of ways and where they will be to the disadvantage of the population of South Dakota, and it will be tough on individuals, and there also is a more global, if you can use South Dakota in the global terms, a global effect economically to the state as well. So a lot of the components speak to reimbursement. They speak to barriers to being in the program, restricting those that are eligible for the program. And one of my concerns, because I have been an advocate for the expansion of Medicaid in this state, is that the Medicaid expansion, that population that has signed up, and I believe we're about 17,000, which is 30,000 less than we should have signed up, and that's a marketing issue. We can talk about that later. But those individuals may just at the drop of a hat, with the passage of this legislation, lose their Medicaid coverage.
Mm-hmm. Do you have some numbers on how many individuals are expected to lose Medicaid with this bill?
That would be that could be broader. In the country, you're looking at millions.
I saw some data, see if this makes sense to you, that there was about 13,000 people
in the state of South Dakota that would totally lose right off the bat. Off the bat.
And then if you add in the loss of some of the ACA tax credits, that would increase those numbers up to close to 20,000. Right. Yeah, that's a lot.
And the bill also contains components for, just let me give you a little 101 on Medicaid. It is a shared funding between the state and the federal government. And in the state of South Dakota, we have typically been between 50 and 60% that the federal government covers, and the rest is on the shoulders of South Dakota for funding. For the Children's Health Insurance Program, which is part of Medicaid, that is a larger number that the federal government covers, and on the expansion, it's a larger number. But if and they call it FMAP, the federal component, if that should shift to the detriment of South Dakota, those that are on the expanded component will be completely out of the Medicaid program. And so that is just automatically nothing. So then you're not looking at any preventative care, you're not looking at vaccinations until people are old enough to be on Medicare, or maybe get to be part of a program that a community might do, but that's pretty rare. It's not like in the 60s when they lined you up for your polio stuff. That doesn't happen anymore. So it just is a huge loss to the individual, but then you have to look at the facilities, the providers, because the providers aren't going to be paid. And here's the story, is if someone has health care coverage and they are not well, they seek health care, and then they are treated and managed within a reasonable cost. If someone does not have any health care coverage, and we've seen this from our neighbors and even maybe family members, those individuals will put off until they're so stinking sick that they're in the emergency department. What is your most expensive care? Is catastrophic care. So, and it's not your best care because it's fractured care. And bless the hearts of the ED staff, really. I really think the world of them. But when someone shows up in the emergency department over and over again until they finally are sick enough until they're filtered into the hospital, they have a different provider over and over again. And that is expensive. So now that individual does not have the financial foundation to be able to pay for that. So if it's written off as a bad debt, then the hospital eats that, the emergency doc doesn't get paid, and it just is a skyrocketing, spiraling scenario of loss of funding and then the inability to provide care. There are several hospitals within South Dakota that are in big danger if this legislation should pass. And there are hundreds throughout the country that are in danger should this Medicare shift, or Medicaid shift take place.
And so with that, losing more rural hospitals, that makes it not just poor care for the people that were on Medicaid, but how about the whole community?
It's for the whole community. And really we're sitting in Deadwood. It's a very good example. If someone has a situation that they are having an evolving myocardial infarction or heart attack, if they present themselves if they drive to Deadwood, or the ambulance takes them to Deadwood, which is 10 minutes, 15 minutes, they can be presented, they can receive thrombolytic therapy or clot buster, people might call it, and then be transferred to a tertiary care facility in Rapid City for continued care. But in the meantime, they have not had a big damage to their heart. They have a small amount of damage, and they can have a magnificent recovery and have a very good quality of life following that. If they have to be, even if it's transported by ambulance, and yes, we have a helicopter, but they're not always available, and this is weather. We live in the mountains. This is weather. You can't always bring a helicopter here. And the hour it takes to transport someone by ground, that's a lot of heart tissue that gets destroyed in the transport process. So and that individual may have the best health insurance possible, but it doesn't matter.
If
the services aren't here, the services aren't here, and that's over.
I did read something that with these cuts, you can anticipate a loss of life of anywhere from 50 to 100,000 individuals, not in South Dakota, but immediately in the United States, just from loss of care. And then you throw in reduction in access. It's a huge factor.
It's a huge factor.
So our Medicaid, we have in South Dakota about 145,000 individuals on Medicaid, and 63% of those are children?
Yes, the Children's Health Insurance Program is part of Medicaid, is part of Medicaid, and they're large. And then your next is going to be the aged and then disabled. So you're really looking at vulnerable populations to be supported with Medicaid for the most part.
Yeah. And what the costs, the Medicaid dollars that are spent in the state, what group do those most go to?
Not typically. There are 10% of the Medicaid population, and typically the disabled, that actually spend about 60% of the Medicaid dollars because they require so much support and care. And a real bonus for South Dakota, and Department of Social Services worked in concert with providers and other disciplines to develop the home medical model, and these individuals with chronic conditions are then managed so they aren't in the hospital. You know, if you have someone with congestive heart failure and they become worse and become so very ill and then in the hospital, and then you get them better, and then they go along and they're not managed, and then they get worse, and then they go to the hospital. And you can do this with chronic illnesses such as diabetes as well. So it's expensive, and their quality of life is really impacted, because especially if it's an aged person with a chronic condition, their trajectory, they may get better, but they never get back to optimum. It just is a spiral going down where they will eventually fail, and your Medicaid dollar then has been spent and you don't have a good quality of life or a good outcome.
And it's my understanding that those services are also being cut back by the state and whatever with the budget cuts for the home health programs. That's a big...
It is, and it's pretty restrictive to, the home health not so much, but this is like a home, it's not modeled being at home, but they just use the word home as to keep, well, because some of that is taking place in the home, being monitored chronic, like for congestive heart failure, weight and blood pressure, heart rate, and they would be examined. Some hospitals have used very cleverly their ambulance team, the paramedics, to go into the homes, and that's a model that I know is used a lot in Minnesota, and that there's been discussion and some movement towards that in South Dakota as well.
Can we circle back a little bit to the nursing homes, right? We were talking about the elderly and when they are in nursing home care. What is the financial status of our nursing homes in the state?
Well, our nursing homes in the state are, they struggle. And a lot of them have had waivers for things such as having sprinkler systems put in. Many of the nursing homes, the long-term care facilities in the state of South Dakota are old, and they can't always be retrofit with the design and the safety components that are required by the state. And those state regulations actually come from the federal government for the most part, and the state administrates those and does the monitoring of those. So they are aging. They are almost always semi-private rooms, and I have an issue with that because I think people deserve they deserve the respect of privacy for both infection control, confidentiality, and just maybe human dignity is how that goes. So they are struggling with both the physical plant, and they struggle with staffing, because that's hard work. And it's not just hard physically, it's caring for humans requires a lot of emotional expenditure, because they're people and you have to treat them with respect and dignity. And that is very difficult for a lot of the long-term care facilities. And if you don't have the physical components to support people doing their jobs, they're not going to stay. They're not going to stay. But can you afford to buy a good lift or a nice tub, or have rooms that are large enough and private to care for people when you are not being reimbursed for what your cost of care is already?
Because aren't they like most of them are operating at a deficit already?
They operate at a deficit.
So,
yes.
Are you aware of the bill out, the filial bill? I'll say right, filial bill that is in effect in South Dakota and has been used in some cases where children are responsible for the payments that to the nursing home that the Medicaid isn't covering, right? And it can hold them liable for all that financial cost. Now, has it happened a lot? No, but it's something that's a real possibility.
Well, the more pressure, the more financial pressure you put on these facilities, I can see where that would happen. Because that individual that is on in long-term care that is funded by Medicaid has already, their assets are gone.
Right, and there's over 50% of seniors in long-term care
are Medicaid.
On Medicaid.
They are on Medicaid.
Yeah. So it's a frightening issue.
It's tough. It's tough for the recipient of care, because they really are at a point in their life where they aren't capable of managing their own care. So they really are at the mercy of the Department of Social Services, the legislators that look at the funding, and their family as they can best do it. But if you look at the mode of income in South Dakota, I would say don't give me the average, because you're averaging in millionaires, and you really need to look at what most people make in South Dakota, that chunk. And it's not enough to be able to cover the expenses. And they might be able to, Medicaid might cover the long-term care, but if there are other needs, such as physical therapy, that maybe they don't meet the Medicare requirements, that adds up pretty darn quickly. So that should scare people to know that it's out there, it's kind of lurking in the woods, that if the state should become so compressed with their funding, and that will happen with this bill, it totally compresses funding. There are many components, and I'm going to just jump into this because I'm thinking of it, but there are components in that bill that will allow the federal adjustment for funding to be restricted if they don't follow the rules perfectly for that in that new bill. So if you have someone that has applied for a work permit, and they get a work permit and they're trying to become a resident of this country, in that gap time, in some states allow them to be Medicaid recipients. And in this bill, the federal government will then cease a component of their funding for that. So, and they can cease it for anything. In fact, the Medicaid expansion, people are really at risk right now. Medicaid expansion and children's health insurance are both reimbursed by, they're funded by the federal government at a greater rate than the standard Medicaid recipient. And if this bill goes through and the federal component is reduced,
Has to come from somewhere.
The South Dakota legislature in this session, 2025, passed legislation that said if that federal monetary assistance is decreased for the expanded Medicaid recipients, that program, that component of the program is over. It is done.
Let me go into just to reiterate about this bill, right? This bill is the Republicans' roadmap. It is their policy, it's what they want. It is so damaging to so many things in our country. Like it will create a huge, increase our deficit, providing tremendous tax breaks to the wealthy, and then gutting a lot of these very important programs. Now, the current bill, I mean, this is what the Republicans want. This is what their policy is.
To what end?
To what end?
To what end? To the detriment, really, of the health and the economic stability
of our country, our state.
Our state. Well, here's the thing: is that if George is well enough to go to work because they're a Medicaid recipient and his diabetes is managed, then the community benefits from that, because George is getting paid and he's going to the grocery store and he's paying sales tax and he's buying the milk and is keeping the dairy farmers going. But then if George does not have health coverage and cannot manage his diabetes, he is sick. And so not only is he's not working, and he's running up emergency bills that aren't going to be reimbursed, and it's just a spiral.
Right.
In order for a corporation or a billionaire to have a tax break, it does not make sense to me. And you're in healthcare, you make a pledge that you are here to care for people. It's not just about giving them a vaccination or wrapping their wounds or whatever. It's about caring for people as a complete entity, as a complete entity. And this just strips away your ability to do that.
And we all want that. We all want to be treated as complete entities, and we want that for our families, our friends, our neighbors. And this bill guts that, right?
It gets it completely.
And so, but I keep going back to, this is what the Republican Party wants.
But is that what the Republican Party wants, or their leadership?
Leadership, maybe.
Because
that's
I think if you had this conversation with, if you got, drove Republican off the street and said, did you want to give this billion or more money and take away the health care option?
They'd say no.
They would say no.
Right.
Because that's their neighbor.
Yeah.
I don't get it either.
Yeah, and so the bill as it is now, right, is in the Senate, and it's going through all these changes and trying to figure out what they're going to do. And the parliamentarian has taken out the part that is related to policy, right? Like, these are the policies they want implemented, and said, for a reconciliation bill, you can only do budget, you can only do financing, you have to take that stuff out. But what it shows us is these are the things that this administration wants. And so there's a lot of pretty serious things that are being pulled out of this bill now as policy issues that I think are really significant issues for South Dakotans. I know you have some thoughts on those.
Well, they're significant, and that doesn't mean because they're pulled out of the 1,028-page bill that they are going to die.
Correct.
Because all your people in Congress have to do is then just craft a standalone bill, or they could take all of the policy components that are non-budgetary and make that into one that says, if you care for someone that isn't a citizen, you will be punished by this. I mean, they also, so the pieces, I'm hoping, and I need to investigate, this is difficult because you can go online and you can call your senator's office and no one is available to tell you.
How many times have you called Senator Thune's office and asked for
Well, this week 3 times.
Okay.
Just this week 3 times. I've called rounds, but he has an answering machine, and I have Congressman Johnson on speed dial. So, but because I let him know, I thought that what you're voting for in this bill does not reflect the values of your constituents in South Dakota. The people in South Dakota don't want someone next door to go down the tubes because we decided we wanted to give the billionaires more money. That's not how people think. So that's been frustrating. So it is a moving target. It is really difficult to grab a hold of. It's like a melting popsicle, you just can't keep a hold of it. So that's frustrating, and I understand that our Senator Thune is very busy and his office is busy, but there needs to be some way for his constituency to be able to access this information instead of waiting for it to be on the news. That is just, to me, opportunity for improvement is what I would say. But you really have the people of South Dakota are at risk. So it's the people that are the beneficiaries of Medicaid, and the communities that have a non-healthy population versus a healthy population. And if you get into, not too deep into the weeds, but if you teach people how to care for themselves, and that's why the Children's Health Insurance program is so wonderful, because they are cared for from the get-go. They get their vaccines, they're monitored, they can get a physical, they can get treated, and so they learn how to care for themselves as they mature. A lot of people are in their 60s and decide, I should have been paying more attention to my body. But you don't do that by yourself. You really need the foundation of a healthcare team, and that's not a lot, especially if you have, at the beginning, your structure is to support wellness, and then you move into the illness model. But we're missing the boat on that if we strip away this funding.
Well, and when people have to decide, do I pay for, I'm well now, do I pay for maintenance versus paying for groceries versus paying for my insurance on my house or my property taxes? They have to make tough choices, right, about that. And I think that's a huge thing. There were some other issues in this bill that I know you and I have discussed before that I think are critically important for us to keep tabs on. The policy issues that have been pulled out, but like you said, they're not gone. They're not dead. This is what this administration wants to have happen. You want to address a couple of those?
Nonetheless, even if they are stay in this bill, and the parliamentarian says, yes, these are budgetary. The budgetary issues are really the ones that are the most concerning, because it can shut down healthcare so readily, especially in South Dakota, and the chronically ill, the children, so many. I'm trying to think how a huge proportion of the children in South Dakota are covered by Medicaid.
Yes, it is. It's
I think it's like 40%. It's big.
It's a very large proportion.
So if we don't take care of our kids, then they're not going to be successful adults that pay the taxes and go into the professions to take care of us when we get older.
Yeah.
But it is distressing that the concerns I had as a bedside critical care nurse in the 80s, where I took care of patients that had strokes because they didn't take their medication because they had to choose between the gas bill or the rent or their medication. And we have not moved very far off of that. And that is really a concern. The Medicaid program is a wonderful support system. The last thing we want to do is to go out there and cut it. And the last thing we also want to do is destroy people's access to outside, because health, and I'm a nurse, I've not had an education to be a physician, but as a nurse, it's body, mind, spirit, and they are inextricably linked. And if you can't take care of your spirit, your body isn't going to do well. And if you're not mentally stable, your body's not going to do well, and your spirit's not. They're all hooked together. And with that, we need to be able to be out in nature. And I'm very concerned with the addressing of public lands and how they're at risk to be turned into opportunity for someone to make money. And that's all that's about. That's all that's about. So people need wilderness time, they need outside time, and they need
clean water, clean air.
Well, yeah,
those things too,
there's
right?
water.
And there are those issues, and those are all part of, like you said, the complete person, the whole person, keeping people healthy for the future. This bill does not do that.
Does not do that.
It helps the rich, and it makes our deficit bigger, and that's just not where we want to see.
It seems like a very inappropriate allocation of our resources to, and we are really, since the Great Depression of the 30s, the disparity of wealth is the greatest it's ever been. So we have less people with more money. They have more of the wealth of this country in a smaller cluster than they have more money than ever. And that does not make for a productive, healthy, whether it's physically, financially, or mentally. It doesn't work. Does not work.
Well, anything else you want to say?
I don't know. Do I? Let's see. Oh yes, I do want to speak to the hospital payments. Medicaid reimburses providers at a certain rate. It is not the expense of their hospital care. And the funding for rural hospitals to be able to keep them operating has been a process with the establishment of critical access hospitals, has been to the benefit of so many people in South Dakota. Critical access hospitals, West River, Phillips, Sturgis, Lee, Deadwood. Spearfish is not, it's too big, but they're all over. And if you don't have these rural hospitals, as we spoke to, we're in trouble. But they, even with Medicaid reimbursement, they do not get reimbursed the cost of giving care. So people need to understand that those facilities and those providers are committed to the health of their communities, and they make it work through the support of the federal government. You start pulling out the pins of support, and those care entities are going to collapse. People need to know that.